Well, good afternoon, everyone, and welcome to Trust for America's Health Age-Friendly Public Health Systems, or AFPHS, monthly training series. This is our final training of the year, and we know this date is a bit off from our regularly scheduled trainings on the third Thursday, so you made it. We're really happy that you're here to join us today to learn more about how the public health sector can support older adult health and well-being. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Cron Phillips. We lead the AFPHS movement. And this movement would not be possible without the generous support from and partnership with the Johnny Hartford Foundation. Next slide, please. So as a gentle reminder, we ask that you please keep yourselves on mute during the presentations. Feel free to put your questions in the chat throughout the presentation. And our guest speakers today have also offered to answer questions during the presentation. So if a question comes up, if you want to raise your hand, and then we'll call on you, you can take yourself off mute and we can have the discussion during the presentation today. We want this to be as interactive as we can make it, and want to make sure that we're responding to all of your questions. Next slide, please. So as most of you know, TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person and individual. TIFA produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness, and Pain in the Nation, focusing on the epidemics of alcohol, drug, and suicide deaths. We've produced several reports as well as part of our AFPHS movement, including briefs on housing and rural healthy aging. And these briefs include recommendations for public health actions that are aligned with the AFPHS 6Cs framework. Next slide, please. So our AFPHS framework, the AFPHS movement, was developed to elevate healthy aging to a core function of state and local public health departments. We're joined in this effort by numerous national partners, and we collaborate closely with representatives of other age-friendly ecosystem partners. The AFPHS 6Cs framework is a strategic tool to advance the vision of elevating healthy aging as a core subject across the country. Today, we'll be focusing on programs and tools that I know you see communicating circled. We're actually moving up to complementing today, but we'll be focusing on programs and tools that complement existing health programs with a presentation from our partners at the Association of State and Territorial Health Officials, or ASTO, whose resources have a focus on improving equity and sustaining healthy aging programs. Next slide, please. I'm going to introduce our speakers. We have Tyrone Bethune, who's a senior analyst in the Health Improvement and Healthy Aging section at ASTO, and Kelly Waugh, an analyst also with the Health Improvement and Healthy Aging team. Welcome, Tyrone and Kelly. Really happy to have you, and I'll turn it over to you all now.
All right, just want to do a quick mic check. Can you hear me?
Yes.
All right. Good afternoon, everyone. My name is Tyrone Bethune. I'm a senior analyst at ASTO in Health Improvement and Healthy Aging. I use he, him pronouns. I'm a Black man in my 20s with Black hair. I will also turn it over to my co-presenter.
Hello, everyone. Good afternoon. As Megan shared, my name is Kelly Waugh, and I am an analyst on the Health Improvement and Healthy Aging team at ASTO. I use she, her pronouns. I am a white woman in my 20s with blonde hair.
All right, and the title of our presentation today is Promoting and Sustaining Equity in Healthy Aging and Older Adult Health. Next slide, please. To give more context about ASTO, ASTO is a nonpartisan organization and the collective voice of the nation's health officials. Its members are the chief health officials of the 59 states, territories, and freely associated states, as well as Washington, D.C. Our mission is to support, equip, and advocate for state and territorial health officials in their work of advancing the public's health and well-being. Next slide. Wanting to provide a glimpse of our team, we are led by our Senior Director of Chronic Disease, Health Improvement, and Healthy Aging, Erin Bayer. The Health Improvement and Healthy Aging Director is Talia Sands, and followed by Priya Shah, Kelly Watt, and our intern, Brittany Lee. Next slide, please. Our team takes a both-and approach to aging as a public health topic, meaning we prioritize both healthy aging and older adult health. Healthy aging focus is overarching what public health can do to help people age healthily throughout the life course and reach older adulthood as healthy as they can be. Once people reach older adulthood, we want to strengthen public health's role to support that population's health. We frame toward the positive. We want to see equity in aging well over the lifespan and life expectancy across groups. And we can get there by promoting healthy aging and older adult health. Next slide, please. Technical package, the process. An ASTO technical package is a summary of a select group of related interventions that together help achieve and sustain substantial improvements related to a specific risk factor or health outcome. ASTO's technical packages are based on internal subject matter experts' assessment of evidence-based interventions, expert recommendations, overview of current activities, and a review of the CDC and other federal guidance. They are not intended to be comprehensive and can be iterative. In this iterative style, we've applied the PDSA, the Plan, Do, Study, Act cycle, consulting experts and literature, taking that feedback and layering it into our portfolio and incorporating our findings into our CDC work plans. Next slide, please. Healthy aging and older adult health technical package objectives. As the public health workforce continues to address healthy aging and older adult health, our team at ASTO huddled to create a technical package or a set of recommendations to guide public health activities. While our list does not contain an exhaustive menu of recommendations, the key interventions we prioritize are guided by scientific evidence, promising practices, and subject matter expert endorsements. Our findings suggest that health agencies have a unique opportunity to champion 5 synergistic categories: paid family and sick leave, healthy community design, fall prevention and mobility, telehealth access, and strengthening the healthcare, long-term care, and public health workforce. Next slide, please. Starting with those elements, paid family leave and sick leave are benefits that address economic security and health for employed people, including family caregivers, as well as care recipients of all ages. Some of the evidence suggests that paid family leave is beneficial to child and infant health. It reduces older adults' risk of nursing home admission and also improves parents and family caregivers' economic security. Next slide, please. Here we have a call-out box or icon just to emphasize that we urge our state health officials to be a part of conversations with other decision makers, employers that can inform paid leave policies such as health benefits, eligibility criteria, leave duration, benefit amount, and job protections included in legislation. Next slide. Promote fall prevention and mobility. Building capacity and infrastructure within health departments and organizations for fall prevention and mobility helps promote age-friendly environments. Falls are one of the leading causes of death in adults age 65 and older. CDC reports that nearly $50 billion is spent on medical costs related to non-fatal fall injuries. On the right side of this slide is a snapshot of the ASTO's guide for state health departments titled Expanding Fall Prevention Through Surveillance, Community Clinical Linkages, and Strategic Planning. That document is already out in the world. My colleague Kelly is going to put a link in the chat that can take you to a downloadable copy of the Falls Guide. Next slide, please. Another call-out box here, and this reminds us that to reduce falls risk and improve mobility, health agencies could conduct fall surveillance, support evidence-based clinical and community-based fall prevention programs, and provide funding or other supports to increase the availability of fall prevention resources. Next slide. Support healthy community design. Supporting healthy community design involves planning and designing communities that make it easier for people to live healthy lives. This could look like planning for equitable access to community resources, intentionally designing communities to promote physical activity and social connectedness. Next slide. Here we advise our state health officials to use their authority and use their voice to promote health department participation in local planning and their influence to provide guidance on healthy community design practice, principles and benefits. Next slide, please. All right, so next we have increasing telehealth access. And I think it's really important to note the use of telehealth really became widespread during the pandemic and has really shown benefits in access not only for older adults, but also for adults of all ages and abilities, including those who live in rural areas, those who are homebound, and those who may have limited transportation access. Next slide, please. Here, we encourage our state health departments, our health leaders, our administrators to reimagine existing and future partnerships to expand broadband access for older adults and their caregivers and improving accessibility of telehealth. Next slide. Strengthening the workforce. A robust and skilled long-term care, healthcare, and public health workforce is essential to delivering equitable, efficient, and high-quality care that improves health and quality of life for older adults. Long-term care workforce shortages are a persistent challenge across settings, which were magnified by the COVID-19 pandemic, with implications for health, safety, and independence of older adults and people with disabilities who have long-term care needs. Next slide. Here we remind our health officials that they have the capabilities to collaborate with Medicaid agencies, long-term care providers, and policymakers to build and elevate the skilled long-term care, healthcare, and public health workforce. We are so much better together, and together we can strengthen infection control practices and quality of care in nursing homes, improve compensation, training, and job quality for workers across the long-term care continuum. Next slide. Here we have a sneak peek of a figure that is included in the publication of the technical package, which lists out each of the technical package elements alongside potential indicators, mechanisms to address these elements, as well as the levels of influence. And my colleague Kelly will also be adding a link to this resource in the chat.
Tyrone, I wonder if I could stop you there
and
ask a question, and I hope I'm not throwing you for a loop here, but we know that telehealth access is so important for older adults, particularly in rural communities where often older adults don't have access. They don't necessarily have the transportation to get there. So we also know that in many rural communities, there is limited broadband. And so what advice do you all provide for, like, how can a health department work to increase broadband and to make sure that older adults have better access to telehealth?
Yeah, that was one of the things that really came up while we were researching this work. And we recommended state health departments and, our partners to really think about and think, strategically and abstractly about ways to increase the grant funding that can support some of this work, to be a part of conversations around policy, to be in communications with broadband suppliers in the area. So those are some of the ways that we have began some of the work to see how we can increase telehealth access. We also know that there is a lot of work around digital health equity that is pushing out right now. And so we are still learning. We are still looking at this. This is something that is breathable at ASTO. Like we still go back and try to understand, how can we better support our states? How can we better support our state health officials in having these conversations?
Great. Thanks, Tyrone. That's really helpful.
For sure. And next slide, please. Wanted to circle back to this slide to center us for the next segment of this presentation around sustainability. And as I mentioned, these are our healthy aging and older adult health technical package elements. If we were to drop the healthy aging and older adult framing, we could see these elements prioritized across other determinants of the health outcomes and all across public health. Public health is ever changing. And so we will need to communicate across sectors, find ways to collab, find ways to think critically about the ways that we can weave in our priorities seamlessly and do this in a way that is pleasable, but also that we can kind of sneak it in. So now I will turn it over to my colleague, Kelly.
Great. Well, thank you so much, Tyrone, for providing really that very helpful overview of our portfolio of work here at ASTO. And I think that will frame everyone's understanding very nicely leading into this next portion of our conversation around how we really can sustain this very beneficial work. So I want to start off our conversation today by acknowledging that while I am not an expert in sustainability by any means, I really have dedicated the last several months to understanding the significance of this topic, especially in the context of the work that all of you are doing every day to advance healthy aging and older adult health outcomes. Now, our team at ASTO has really set out to better understand how public health leaders can plan for and elevate sustainability in their initiatives. We have had insightful conversations with 3 state health experts, an academic expert in sustainability, and reviewed resources that are out there about sustainability and public health. So based on all that information gathering, we've extracted some key strategies for sustainability, which I'm very excited to share with you today. Now, prioritizing sustainability really requires a very intentional mindset shift. So to begin, I want to take a moment and step into sustainability. Now, I invite you all to reflect for a moment on the significance of this topic and what this means to you, to your organization, or just think about how this might manifest itself in your ongoing priorities. So I'm going to pause for reflection for another 10, 15 seconds more. And during this time, I would really encourage you all to maybe jot down a few preliminary ideas that come to your mind about what this work means to you or your organization. And if you feel comfortable, I welcome you to start sharing some of those initial key words, thoughts, phrases that come to mind in the chat now. Great, seeing some fantastic additions to the chat. And I just want to say, as we continue this conversation together today, please do take note of these things that we all in this space are thinking about and these initial thoughts that we're having here in the chat. And I also invite you at any point, if you feel called to please come off mute, provide your insights or additions, or continue sharing those in the chat. Next slide, please. Now, some of us may have just been reflecting on this topic of sustainability from a programmatic standpoint, such as being a public health program's ability to maintain programming and benefits over time. Or you may be thinking of this a bit more abstractly as a community or an organization's ongoing capacity or resolve to work together to establish, advance, and maintain these effective strategies that will continuously improve health and quality of life for all people. Now, there are many ways that you can define this, many definitions already out there that really adequately depict this term. Now, regardless of how you choose to define this term yourself, my hope for today is that we all can just agree on the fact that this topic of sustainability really requires our attention. Without program sustainability, valuable resources can and will be wasted, and communities can really be negatively impacted through a loss of trust and support. Now, I want to really emphasize this key theme here of trust and encourage you all to carry that with you through the remainder of our conversation today. Building that strong foundation of trust is just so pivotal for success in public health initiatives. Not only is that for the people we are working with, but really for the people we are working for. Next slide, please. Now, to put some context behind this, so many of you navigating this space are very familiar with some of the common limitations of working within tight timelines or short project periods. You may be faced with some limited funding windows or maybe a lack of financial resources in this area. You might be seeing some organizational capacity challenges, some diminished political support, or an essential key element here, a decline in that community trust. So despite all of these hurdles, each of you is still showing up every single day and striving to create effective program activities, connect and convene to maintain your beneficial partnerships, like it was mentioned in the chat, and that importance to sustainability, coordinating across your organization, collecting information and feedback, communicating important information to the public, and really complementing those ongoing existing efforts for continued success and that increased awareness of healthy aging or public health initiatives that we all strive to increase that awareness of. Now, with that context in mind, I think it is very evident that maximizing our resources and seizing these opportunities for creating very sustainable success is so necessary for overcoming and outlasting these frequent limitations that you are seeing on the left here. And that is precisely why our team at ASTO is really calling out this important theme of sustainability. Next slide, please. So listed here are some of the top strategies that our team has identified for integrating sustainability into your work. So while some of these actions may already be prioritized by you or your organization, which is fantastic, adopting the very intentional mindset and goal of sustaining that success can really be that extra step needed for ensuring that long-term impact that we all hope to have. So first, sustainability planning and assessment. Crucial for understanding and ensuring that public health initiatives will be sustained over time as these local needs, the financial climates, and these policies are changing all around us. Now, this planning might include things like responsibility distribution, the formation of long-term attainable goals for a program. And though it is best to begin embedding that sustainability at the very outset of a project, it truly is never too late to start. You can always assess where your current plans or your actions may already embrace sustainability, and then really work to institutionalize your practices from infrastructure that already exists. And workforce development, necessary focus for maintaining that skilled, motivated workforce that's needed to sustain the intended benefits of your program or your initiative. And that can be done through exposing yourself or your staff to new skills and information that really helps everyone engage in a more successful work environment and just work better together in doing so. So consider how you might be able to influence making organizational or departmental training and education on aging a standard practice, such as including this in your regularly scheduled staff meetings or when onboarding new staff members. Sustainable partnerships, that collaboration piece that really helps to align related ongoing work and strengthen that collective effort to achieve these shared goals. Now consider formalizing your partnerships to create sustainability, even in the event of turnover on either side of the partnership. And that can be done through agreements such as an MOU. Investing in existing partnerships you have with other agencies, organizations, or individuals is equally as important as creating new opportunities for collaboration. So when you're working to build in sustainability into your efforts, really just keep these partners near and dear and look for those opportunities for that mutual long-term success. Now, determining and meeting your community's evolving needs. We all know that this job is just truly never done, and it shouldn't be really, but it requires consistently taking time to understand what your community members need, what current data shows and predicts, and then involving those who may be most impacted. Now, engagement at that community level really allows for improved support, informed planning, and effective actions that will ensure those successful health outcomes. Now, effective messaging and communication, I think often an overlooked piece of this puzzle, but is really an important piece to keep in mind as you're communicating and delivering essential information, that tailoring your language or your methods of communication for what your community members need can really play an instrumental role in advancing inclusivity and thoughtfulness around your health promotion messaging. Now, additionally, you can consider some opportunities for cross-promotional messaging across your different program areas for that really impactful messaging to really stick with your audience over time. Now, our team's deep dive into sustainability and the strategies that you are seeing on your screen here has really revealed a very important and central theme. Next slide, please. And that is that collaboration in this work is really key. So the positive impact that each of you is so dedicated to making just simply cannot be sustained alone. Working with your team members really fosters that development of shared goals and amplifies that collective effort to really achieve them across your organization. Partnership really opens new doors for success or can help to grow and build upon your existing initiatives. Diversifying your partnerships is that critical extra step there that really allows you to adequately understand and meet the needs of all the people that you serve. And community engagement is that direct interaction, so crucial for understanding what your community's needs are and exactly how you can best help them to live healthy lives. Next slide, please. Now, our team through this process is really determined that operationalizing equity is the common thread weaved through each one of these sustainability strategies and really tying in that role of thoughtful collaboration. Now, operationalizing equity can really blend seamlessly with your sustainability efforts through actions like establishing that strong foundation of trust with your team, your partners, the communities that you serve, being very intentional about who those partners are that you're engaging with, ensuring that they similarly have a dedication to equitable action, better understanding your communities and what their needs are through some direct engagement, and developing tailored initiatives to support them. Refining your workforce's understanding and ability to execute each one of these strategies and these elements listed above is really so critical for effectively and thoughtfully prioritizing equity in this sustainability work. Now, there are many sustainability strategies that simultaneously operationalize equity. And as we all know, achieving equity is a gradual process. So the goal here is not to achieve equity overnight. It is to make operationalizing equity a part of your everyday normal operations so that while things and environments may be changing all around us, we can ensure an equitable focus for those long-term goals. Next slide, please. Now, to align and kind of call to the front these standout themes of sustainability, collaboration, and operationalizing equity, our team at ASTO has developed a few different products to guide and inform your efforts for integrating sustainability. Now, on the left is a draft version of our Sustainability and Healthy Brain Initiative implementation resource that outlines the who, what, and why for each of the sustainability strategies that I previously shared, followed up by actionable steps to get started now. Additionally, this resource also highlights the successful sustainability efforts that are happening right now in Georgia, Vermont, and Washington State Health Departments. Now, on the right, we are highlighting our program sustainability and HBI work video series that is now live on ASTO's YouTube platform, and Tyrone is so kindly sharing in the chat with you all. Now, these three videos really weave together the common threads of program sustainability, collaboration through partnership, and equity. So while these products really focus more specifically on the Healthy Brain Initiative implementation, we have designed them specifically to serve as universal sustainability recommendations that can be applied to all of your public health efforts. I really hope that through your future investigation of these products and from our training today, that you are motivated about the great potential there is to embed sustainability into your work and the long-term impact that it can have for the people that you serve. So I encourage you now to maybe all circle back and continue reflecting on how sustainability might show up in your work or how you would like to see it show up in your work. So if you feel comfortable, continue sharing one or two things now that you may have jotted down throughout our conversation or that you plan to do to kind of level up your pursuit of sustainability. Welcome you to share those thoughts in the chat now, or if anyone would like to come off mute and share with the group, we would love to learn from anyone who's willing to share.
And I just want to add to the conversation here, thank you, Kelly and Tyrone, that I don't think we talk enough about sustainability. It's like we kind of circle around it, I think, and yet, this is, we have to talk about it in order to implement sustainability. So really appreciate your bringing this to us today. And I too would love to hear what other folks are doing to sustain the work, or what would you like to do to sustain the work that you're doing? All right, we know that elevating healthy aging and certain issues in state health improvement plans and community health improvement plans is one way to think about sustaining the work. And we can't do that without data, right? And so it's really important as well to make sure that we are using healthy aging indicators in our state health assessment and community health assessment processes.
Hey, Megan, this is Keena from Mississippi. I think another way is integrating, especially for Healthy Brain, into chronic disease programs and other federally funded programs. And so we have been working with like our HBI work along with heart disease and stroke for healthy heart, healthy brain, and also diabetes. And then also thinking about our falls prevention efforts. We have now integrated our falls prevention work across our traumatic brain injury partner work and also across our chronic disease programs. And it has been quite successful because we know everyone has limited resources. And so we're trying to identify those shared indicators and those shared determinants, and then work collectively to address them, similarly to the age and dementia-friendly communities. And so we know dementia-friendly communities work has their own framework, but we align that with the age-friendly communities work and just have more of an integrated approach. And it has been exciting to see some of those shared resources in Mississippi.
That's awesome, Keena. Thank you for sharing that. I wonder if I could ask you a little bit more about how that came about, because very often if you're talking about two different programs and two different areas, that there is some siloing that often happens. And so I'm wondering if you could just address how that happened, how that approach happened.
Yeah, there definitely is silos, but we use the data. Just to speak to what Tyrone and Kelly were stating, we use the data. We showed, especially in Mississippi, the chronic diseases. And we also, to complement what was already happening, we came from a comorbidities perspective. And so when we looked at older adults and individuals with chronic diseases, we looked at their comorbidities and looking at the data to show that for individuals that may have Alzheimer's disease or related dementias, they also have another chronic condition like cardiovascular disease or diabetes. And if we can take a whole person approach, it makes it a lot easier for sustainability when we're discharging these individuals and helping them to age in their communities. Working collectively, it allows us to reach more people. And so we did that. But another thing that I will say is ask. We asked our other partners, not just for chronic disease, but just for those non-traditional programs, how can we be a part? And just started initiating that flow of conversation. And for us, it was very successful. Full transparency, I do serve as the PI for the Bowl Grant, and I also serve as the state lead for age-friendly public health. So I had the pleasure of leading a little bit of force behind making certain people talk. but I am not a leader in the chronic disease division. So that did require some reaching across the aisle. But we were also successful, even outside of our agency, with that cross-sectoral collaboration, working with transportation, working with our state unit on aging and AAAs. And all that came about looking at the data, understanding that Mississippi is a state of many negative social determinants, but understanding that we wanted to create a healthy community where we could all healthily age. And we're still working towards that. But with limited resources, we have to be more impactful and give that synergy as opposed to maintaining those silos. And so we also use a wealth of resources from ASTO. So I'll give Talia Sands a shout out because we work very well with Talia in Mississippi to do a wealth of our work. And she has been a helpful resource for Mississippi to really integrate our projects. So ASTO is a great partner for our work as well.
Absolutely. Absolutely. Thank you, Keena. And shout out to Dr. Keena White in Mississippi, who's done so much work to bring together all the different components of the age-friendly ecosystem in the state and has really advanced this work quite a bit. So thank you so much. Jane.
Hello, and I'll lower my hand before I forget. This has been just wonderful, and of course, appreciate the partnership with ASTO and of course Tifa's leadership there. I just wanted to, since Dr. White spoke, I just have to say we are also, Megan, we're working on an article to talk about Trust for America's Health, to talk about age-friendly public health, as well as, and then to highlight Mississippi. And as we were working on that, Dr. White said something yesterday that just kind of rings true here. Is a state that needs work, needs help, needs support. It is even more important that people work together, that the resources that are there, and she said they have I think she said wealth today, but she said yesterday they are rich in being able to work together in the resources that they do have. So I think the point that you've been making in terms of sustainability, it's engaging and working together. So well said, great information. And thank you, Dr. White.
Thanks, Jane. And I agree. And I don't think Mississippi is alone in being resource limited. I think that every state would probably say that they're also resource limited. So I think this is a great lesson and good information for every state to have and local departments of health as well to put into practice. I'd love to hear from others to contribute to this conversation. And I think there's one more slide. Kelly, can we advance the slide and provide your contact information? Then we can take the slides down for a few minutes and see if we can have more conversation.
Yes, definitely. Well, this is a QR code to our Healthy Aging and Brain Health site where y'all can learn a little bit more about the information that Tyrone and myself have shared today, as well as see the resources previously provided in the last slide. And also, our contact information, please do reach out to healthyaging@asto.org if ASTO can at all be of support in your journey of championing these positive and sustainable health outcomes for all people.
Great. Thank you, Kelly. So let's take the slides down. And I also had another thought, and I don't know if any of you are doing this, but how do you measure sustainability? I was having a conversation with someone earlier today about how do we measure the success of our programs in the age-friendly world. And very often, we're talking about long-term health impacts for older adults, which we're not going to see a return on that investment immediately. So how do we measure success? So how do we measure sustainability? I'd love to hear people's thoughts. And of course, if anyone has questions for Kelly and Tyrone, please feel free to ask those as well. So Anne, please feel free to come off mute if you'd like to share your comment.
Oh, sure. So I work in public health nursing in the state of Maine, although my role is different. It's not direct care, but this is an area of huge passion for me. And I just joined my city's city council age-friendly committee. So, hoping to make a little bit of a difference locally. We see lots of issues with falls. We're not super rural, but I think still connectivity is an issue around where I live. So I'm just really grateful for all of your insights.
Thank you, Anne. Yeah, appreciate the public health perspective and coming into that age-friendly committee. I think that sometimes that doesn't always happen. So I really appreciate you bringing that perspective to your community. Others, would love to hear your thoughts about sustainability, measuring sustainability or measuring success. Other questions for our presenters?
Megan, it's not necessarily sort of a recommendation of how, but more so a question for the experts in the room. When we think about our state unit on aging, and we know there are so many, waiver programs and backlogs of access to resources, I think one thing that we have thought about in terms of our statewide action plan is how can we trim those lists? How can we increase the availability of resources, and how can we disseminate? We found out just last week, our Department of Rehabilitative Services provides free hearing aids to older adults of need. And that's a resource because we understand even with brain health and hearing, there's a connection. And so now that we know that resource is available, we're strategizing on how to disseminate that to the right population so that we're not giving it to those who may already be able to afford it, but really being an equity partner in sharing that. And that simply came from an ad hoc conversation. And so when we think about sustainability, how are we better utilizing resources that are available and being able to show that utilization? Because we talk about access to care and underutilization of care, because oftentimes there are resources, they're just underutilized due to limited awareness. And so I think from a sustainability perspective, I would love to hear from others of how they're addressing that piece. Because it would inflate your numbers if there are resources, they're just being underutilized, which makes it appear as if it's less sustainable.
Right. Thank you. That's a really good point, Kina. And, I think that there are some funding opportunities that have been available over the last few years. And I know that these funding opportunities may not be sustainable, like the COVID money, ARPA money, that can be used very flexibly at the state level, and even some money for vaccine distribution can be used to address social isolation. So I think that we have to think really creatively about the funding sources that are out there, and there are also some really interesting examples of community or jurisdictional coalitions coming together and thinking about who has the expertise to write the grant versus which organization may have better expertise to implement the program that the grant is being written for. I think that's happening in Los Angeles of all places. So I think that there are some really good examples of being creative about funding, about grading funding and finding funding sources. So Erica, please feel free to come off mute and share the information about the Commit to Connect.
So I just attended this webinar yesterday, and I think it's a collaboration between the United Way, Department of Aging in Virginia, but it sounded like a really great resource where people could enter their information, sort of do like a needs assessment, and then a whole bunch of resources would be generated based on those needs. So in terms of this idea of how we disseminate information, they are the first one doing it. They don't have results out yet because it's too new. But in terms of, a way to get this kind of information, if they can, scale up, if they have good results, which they're working on generating, it might be something and that could help in other states as well.
Absolutely. Thank you. I attended a call yesterday as well and heard about a program called Connected Communities in Minnesota, where there's funding from a philanthropic organization for this, but they've identified 4 main areas or domains for work and have come together to make sure that older adults are engaged, that they have access to providers, that the providers are talking to the community health, and it's just a really interesting and innovative approach. But again, they do already have funding, so And Kina, thank you for putting in the chat the increased utilization of community health workers, which is also a really good way to sustain the work, because a lot of community health work is supported by COVID-19 funding. Oh yes, Mary Pat, we know that nothing happens in a vacuum, right? All of our work is needs to be collaborative to happen. And I know I see Myra Garcia from Florida Department of Health in Miami-Dade. They have an amazing Coalition for a Healthier Miami-Dade, and they've been doing this work in a coalition work for many years and have seen really great success. So appreciate Mara. I don't know if you have any updates on the coalition, the work that you all lead down there.
Hi there. I don't know if you can hear me. I was trying to take off the camera, but I'm on a dual device here, so I apologize.
We can hear you. No problem. We can hear you.
I always feel a little underprepared for presenting at these, obviously there's different tiers of us as far as practitioners. I'm a nurse by practice. That is my role here in the health department. I'm a senior community health nursing supervisor. And so I have the boots to the ground people delivering health education and screenings in the community. And always part of our conversation, of course, is you eat healthy, you move more, it affects your brain, it affects your heart, it prevents chronic disease in general. But we are statutorily, there's state statutes that we have here in Florida, in Miami-Dade County, that enable us to provide these services. So the goal is to prevent obesity, the goal is to prevent chronic disease, but the Alzheimer's, and my career here at the health department seems like it's now becoming part of the ingrained kind of infrastructure, as far as it was on the state health improvement plan the last cycle, and now of course it's there again. But it takes a while for these infrastructure things to make their way down to Miami-Dade County, I guess. And it's always been part of the conversation with partners, of course, because some of our partner organizations are the Alzheimer's Association, and I participate on the Healthy Brain Initiative that AHEC had, and I participate in the Dementia Care and Cure Initiative that is, I guess, led now by the Alliance for Aging. But funders come and go. And so other than those tried and true core organizations that deal with these things, of course, the universities, our partners at the university, they have, fall prevention. And so other than being conveners, as a practitioner, my role in the health department, I help with that convening. I help with that, across organizational networking and connecting. I feel like we have a long way to go. Maybe not too long, but somehow these things need to be interconnected, because we all know if we have a healthy body, everything else will fall into place. Yes. So I feel sometimes like I'm, riding a big wave that's going in the opposite direction sometimes, but hopefully, things will start to flow in the right direction. So I always feel like I'm not a good visionary. I don't have a public health degree. My degree is in nursing and mental health counseling. So I understand dynamic psychology. I understand right man, right timing. Some of this is political, perhaps, but funding is always an issue. We're very lucky in Miami-Dade County because of the consortium that we're able to get funding into the community because of our established relationship and the Consortium for a Healthier Miami-Dade, which is that you mentioned a different name, but often used as well. Yeah.
I got it wrong. So
no, that's okay. I mean, a name is just a name. The thing is that we are connected. We have people coming to the table, the right people. I always feel like, well, what am I doing today? I feel like it's a lot of what I do is relational and keeping those relationships going, pointing people in the right direction, but funding to me, that doesn't come across my desk. I'm not the one that applies. I'm not the one that gets the funding. I don't distribute the funding. That responsibility, luckily, because I'm not good at math, falls on other people. I'm worried about getting the number of services that we have, allotted for in a year out into the community. Where are we doing it? That kind of logistical, putting the services in the hands of the people, and also providing that health education. So that's a long answer to, I don't know what we're talking about a lot of times. when you're talking about funding, sustainability, to me, that has to come from the top and trickle down. I don't know.
Yeah. Well, you're doing a lot, Myra. I know that you were very humble in describing your work, but that you are spread far and wide, and we know that the work you're doing is very impactful, and the consortium work is really important, and I think that helps to make some of those connections in the community. So even though there's a lot of siloing that remains, I think that those kinds of connections are really important, and it's going to look different in every community. Right. And I think that's the beauty of the work that we all do.
Yeah, I feel like we're keeping the waiting pool nice and warm and inviting for all these changes to occur. But really, I need a waterfall to come from somewhere else up higher and come down and say, okay, now this is important. This is all connected. And sometimes, again, I realize, like, I've heard enough success stories to know that sometimes that comes from the top. Sometimes it builds from the bottom, like a stalactite or a stalagmite, whatever. But yes, we have a huge food distribution tomorrow. So for me, each day is different here. Always, moving the needle of health, but sometimes it's a little closer to clients and the actual, and of course, my work with the consortium is then a broader, working with partners and stakeholders and keeping that conversation, the fire is lit there. But yes, my brain is all over the place right now.
Well, as all of us, I think that the sparks are flying quite a bit for all of us. So really appreciate.
Thank you, Megan.
Yeah, thank you. Other comments or questions or thoughts? This has been a really rich conversation. So Kelly and Tyrone, thank you all so much for sharing ASTO's work, sharing the wonderful resources. We really appreciate the partnership that we have with you and look forward to ongoing work together through the next year. I'm going to turn the program over to my colleague, Dr. Karan Phillips, who has a couple more things to share with you all. So I hope you will hold on for just a moment. And stay tuned for our series of trainings next year, starting in the third Thursday of January. I don't know what the date is off the top of my head, but we have a whole new series starting next year. Oh, there it is, January 18th. Thank you, Karan.
No problem, Megan. So yes, thank you all for joining us today. And we look forward to seeing you all in 2024. And we'll kick off our training series again with our Ages of Training on January 18th, and you'll be able to register for that under our events section on our website. And for those of you that are pursuing champion recognition, please take a minute to scan the QR code right here. And if you are viewing this as a recording, you can navigate to the website listed. It's the same as a QR code to account for your attendance for today's training or to acknowledge that you view this as a recording. So I'll give you all just a few brief seconds. And if you, for whatever reason, can't get to it, you can always send an email to an address I'm going to show you momentarily. And that is it for us. You can always reach us at AFPHS@TIFA.org, AFPHS@TIFA.org. And thank you all for joining us today.
Thanks, everyone. Hope everyone has a wonderful holiday season. However, whatever you celebrate, hope you have a time of rest and peace and great wishes. We will see you in 2024.